Welcome to Leadership and Management. My name is Kim McAllister and I am the instructor for today's lecture. Today we're going to look at the basics of leading, managing, and following, and we're going to define what they are, what the tasks are for each role, and how you can be effective in this role. We will also examine tools to help you get started in the role. Some of you are already in leadership or management roles. The course will help strengthen your ability to function in the role and give you some theoretical concepts for why you do what you do. Those who wish to be a leader or a manager will gain tips to develop your skills so you can attain that goal. Following is also a skill that we will examine. In whatever role you have, you're accountable to someone, so developing skills as a follower are also helpful. Here we have a list of our objectives, which I'm not going to read to you. We have a triple aim in healthcare, and this is based on the Institute of Medicine. We need to provide access to quality care, we need to provide quality of care, and we need to control the cost of health care. As leaders and managers, we have a responsibility to promote these aims. Managers are responsible for reducing cost and helping employees maintain quality standards. Leaders encourage and support these efforts. Followers willingly participate in measures to reduce cost, such as accurately checking supplies out to the appropriate patient, documenting supplies that are used in care so that they are reimbursed, and also completing tasks within the shift time to reduce overtime. Leaders are prepared to handle unexpected situations. They have the ability to critically think and can work effectively and safely without being told exactly what to do. Leaders have respect and recognition because of their ability rather than official authority. Now, some leaders are also managers, and in that case, they do have authority. But leadership is not a position that has designated authority associated with it. Managers know the requirements of the job. Managers have a formal position, and they have authority granted to them by the organization. They're able to perform the job that they manage efficiently. Managers understand the protocols and the procedures and aid employees in following them. Think about situations that have required you to enlist the aid of your manager. Why was their help needed? What skills or authority did the manager have that allowed the situation to be resolved? Followers are actively engaged in the patient care process. They adhere to policies and regulations that are set forth by management. They follow clinical guidelines and protocols, and they provide feedback to improve patient care. Followers do not gossip and complain about problems, even though it's fun. Don't do that. They participate in finding solutions. A hallmark of followers are that when they present a problem to managers, they also present a potential solution. Next, we're going to look at tools for being an effective leader, manager, or follower. A big tool is emotional intelligence. Emotional intelligence allows the individual to objectively observe situations or individuals. There are acronyms that may be present where you work that remind you to don't take it personally. They're different little cutesy things that sometimes they post around. So be aware of what those are. Emotional intelligence allows the individual to handle a problem without reacting. There are 5 domains of emotional intelligence. Having self-awareness. Know how you feel and how those emotions are affecting your perception of the situation. So take some time out and think about what I'm feeling and how that's making me react. Managing emotions. Avoid allowing negative emotions to erupt. And boy, that can be tough, but it's important to keep those under control. Motivating yourself. You do not require external influence to perform. You're going to be the best nurse you can no matter what. Being empathetic, being able to look at the situation from all points of view, and handling relationships. You know how to be appropriate, and that's with patients, between you and patients, between you and employees, management, and so forth. And we're going to look at how to be an effective manager, leader and manager. You want to focus on the vision, be a critical thinker, back up your instincts with fact. You know, we're talking about going for your gut. I guess that's why I thought of fat, but go for your, you know, when you go with your gut, there's a reason and a logic behind that. You need to be able to say what those facts are. Accept responsibility and consequences for your actions. Identify with the needs of others. Coach, communicate, and counsel employees. This is why I say a manager has to be the most proficient of a job. You've got to be able to do the job that you ask your employees to do and do it well so that you can help them. Set and maintain boundaries. Evaluate all your options. Don't settle on how it's always been done. Maintain trust and be competent in what you're managing. Know how to do the job better than they do. So let's talk about the theories behind leadership and management and motivation. The first theory we want to look at is trait theory. These are the talents and the gifts that you're born with. So leaders are born, not made. Next, we have style theory. With this, you develop effective relationships with employees and examine factors that impact the outcomes. Situation contingency theory. You examine the situation and adapt the leadership style based on the situation and the characteristics of employees. So in this style, you've got to really know your employees and how they work well. Transformational theories. The leader takes care of the needs of the employees and provides motivation by empowering staff. Transformational leadership is the theory that I use. I've worked as a director of nurses and a manager and also a charge nurse. And when you empower your employees, they will literally follow you anywhere. So this is the motivational theories. First of all, we look at hierarchy of needs. This is the Maslow theory, which you're all probably very familiar with. And this is talks about how people are motivated through different needs. Next, we have the two-factor theory. The two-factor theory, hygiene factors must be in place so work can be accomplished. Motivational factors inspire employees to work well. Expectancy theory, you provide feedback about positive performance. The perceived need to the employee is what influences the behavior. OB modification, this is organizational behavior. Rewards motivate employees to continue the desired behavior. Negative consequences or ignoring, which is called extinction, encourages employees to avoid unwanted behavior. This theory looks at punishment as not necessarily something that achieves the objective. And so the extinction, ignoring behavior is deemed to be more effective. Let's also take a look at complexity science and theory. Complexity science promotes the idea that the world is full of systems that have to relate effectively for the system to work. Nurses have to be flexible and dynamic to effectively handle the interactions between patients, people, healthcare, policy, and relationships. And as nurses, we deal with this every day. And I think that this will probably resonate with most of you. So we have to network, we have to develop relationships with people in other departments in order to enhance the patient experience. It also enhances your work. The more that you network and you know other people outside your little world and your unit, the more effective you are and the more useful you can be to your patients. Let's look at the specific tasks of leaders, managers, and followers. So with leadership, our tasks are to envision goals, affirm values, motivate your employees, manage resources and people, build a team, and build trust. Be knowledgeable. Support and stand up for your team. If your team knows that you will support them, they will do anything for you. Keep your knowledge current. Make sure that you're maintaining your skills and whatever knowledge you need in the area where you work. And you want to encourage self-care. You want to take care of yourself, and you want to be sure that your employees are doing that as well. For tasks of managers, know what you're responsible for and what you are not responsible for. Sometimes knowing what you're not accountable for can be even more important than what you are. Know what your boundaries are. Know what you can do, what you can't do. Know what the standards of performance are for your employees and how to evaluate them. Validate the ability and the knowledge of your staff. Develop a vision for your employees, for your unit, and then communicate that vision. Don't keep it to yourself. Your employees need to know where they're going. Promote equity, recognize and reward performance, and engage employees in decision-making and request feedback. It's important to keep notes about behaviors on employees when you're getting ready to do your performance evaluations. It's great when you can pull up documentation, and you want to catch employees doing things right as well as identifying things that can be critical or can cause problems. Task of following, develop accountability for yourself. Make sure that you know what the rules are and that you're following them. Maintain standards and comply with regulations, even the ones you don't agree with. Offer your skills to others, and you want to complete your tasks. You want a collaborative work ethic, work with others, don't just focus on you. Utilize best evidence, best practice, and participate in outcomes measurements. That's really important with certification, and when you have a joint commission visit, you have to be sure all those outcomes are met. Be accountable to the team. Be willing and receptive for change. Evaluate systems for effectiveness and safety, and provide appropriate feedback. That means giving the right feedback and giving it to the right person rather than, hey, did you see what she did? It was terrible. Yeah, don't do that. So in conclusion, leading, managing, and following are required for an effective workplace. Examine your current role and see how you can improve in that role. Take note of what's required to develop into new roles and begin working to obtain that role. Next, we're going to look at how to develop as a leader and as a manager. Thank you.